Assalamualaikum and good morning everyone. So before I start my individual oral presentation, let me introduce myself. My name is SITI FARAH ADILAH binti ZULBAHARIN and my metric number is 148834. I'm a biology student majoring in entomology and parasitology. So for today, I will be presenting on one of the parasitic disease, which is Onchocerciasis. Onchocerciasis, also known as the river blindness disease, is a parasitic disease that are caused by a filarial nematode, the Onchocerciasis, and it is transmitted by the intermediate host, the black fly, which is the similar species. The river blindness is most common in a tropical and sub-Saharan region of Africa, and additional foci in Latin America and Middle East. People that are most likely to get Onchocerciasis infections are the people that live in remote and rural area or near the streams or river. So if you ever wonder, the disease spreads by an intermediate host, which is the black fly, that breed in the flowing streams, hence the name river blindness. So during the blood meal, the black fly will bite a person who has an Onchocerciasis infection, and it will ingest the larvae of Onchocerciasis, or we call microfilariae, that located in the skin. So the ingested microfilariae will then migrate from the midgut of the black fly into the thoracic muscle through hemocoel, and it will develop into the first stage larvae. The first stage larvae then will develop into the third stage larvae, which is infectious at this time. So this third stage larvae will migrate to the black fly's proboscis, or the mouth part of the black flies. So when the black fly bites another person, the microfilariae will penetrate the skin of that person, and after 12 to 18 months, the microfilariae will start to develop into adult Onchocerciasis. The adult Onchocerciasis commonly reside in the nodules and live approximately 10 to 15 years. Some nodules may consist of female and male filaria. The female filaria may be as long as 33 cm to 50 cm in length, while male filaria is 19 to 42 mm in length. The female filaria are capable in producing the new microfilariae, or the new larvae, which is mainly found in the skin and lymphatic of connective tissue, and sometimes it can be found in peripheral blood, urine, or sputum. This microfilariae will then be ingested by a black fly, and the cycle will be repeated when the black fly bites another person. Next, a person with Onchocerciasis infection or river blindness disease may experience swelling on the lymph nodes, such as femoral and inguinal lymph nodes, which is located in groin. Other than that, Onchocerciasis may cause skin rashes, severe itchiness, and depigmentation of skin due to the inflammation after the microfilaria dies. In severe cases, a person with Onchocerciasis infection may have symptoms of inflammation in the cornea, which can lead to complete blindness. The river blindness disease or Onchocerciasis infection can be diagnosed through the microscopic examination of skin snip, which is the most common way to diagnose the Onchocerciasis infection, and slit lamp examination of cornea and anterior chamber of the eye. For skin snip examination, a shaving or biopsy of skin, usually 1 to 2 mg, is needed to identify the larvae that emerge from the skin snip. The skin snip will be put into the saline solution before it can be observed under the microscope. Usually, there will be 6 samples of skin snip taken from a different region of patient's body for the diagnosis. If in any situation, if the larvae cannot be seen under the microscope, the researcher will conduct a polymerase chain reaction test or PCR test to identify the DNA of the larvae. In some cases, the nodules will be removed from the patient's skin so that the doctor can examine the adult Onchocerciasis volvulus. For slit lamp examination, the anterior chamber of the eye and the cornea will be observed to see if there is any visible larvae or wound that appear in that particular region. Another diagnosis that can be done for onchocerciasis infection is antibiotic examination, but this examination is not widely used as it is not capable to distinguish the current infection with the past infection, but it can be useful to the person that does not live in the area where most of the parasites are found. So in conclusion, the only way to treat this parasitic infection is by using an anti-parasitic drug, usually ivermectin. So patients with onchocerciasis infection need to take a single dose of 150 mg per kilogram of ivermectin between 6 to 12 months repeatedly. Although the ivermectin cannot kill the adult filaria, it can slow down the production of microfilaria, hence reduce the microfilaria in the patient's skin and eye. The duration of this treatment is depend on the patient's condition, but if the skin snip examination and slit lamp examination shows no presence of microfilaria, then the treatment will be ended. In addition, before taking the ivermectin, a person with onchocerciasis infection should first check for another infection that caused by another filaria nematode, which is luar-luar. This is because ivermectin can cause severe effect to luar-luar infection. So another treatment is by using doxycycline to kill a bacteria called Wolbachia. So by killing this bacteria, the adult filaria are unable to survive, as it depends on the Wolbachia for survival and embryogenesis. In any cases, it is possible if the patient with onchocerciasis infection to be treated with both ivermectin and doxycycline, as doxycycline is capable to kill adult Onchocerciasis volvulus but not the microfilaria. That's all from me. Thank you.